Gail asked me to give you a little peek into my first year as a legislator. Those of you who know me know that advocacy has been my hobby for many decades now, not too many, just a few. I don't want to be too old. It's been a hobby of mine for a long time, but particularly in the last 10 years, I have been up at the Utah legislature and in Washington, D.C., advocating. I was elected to the State House of Representatives, representing Highland, Alpine, Cedar Hills, and a little piece of Suncrest Draper on December 7th of 2025. It was a special election. There were about 130 delegates from that House district that voted, and I got the seat. So, thank you. So, having children with chronic illness, I am very sensitive to the food issues that we have in the United States. My children can eat almost everything in Europe, but they're very, very limited in what they can eat here. I filed 2 bills immediately on being elected, and the first was a bill to adjust what kinds of food-like substances we can fund with SNAP or EBT or food stamps. So SNAP stands for Supplemental Nutrition Assistance Program. And oddly, I think that it should only be funding nutrition rather than soda pop. So I opened that bill file. I was immediately discouraged by the Department of Workforce Services, who said that in order to do that, we would have to apply for a waiver from the federal government because it's federal regulation, and that nobody had ever received a waiver before, and so they didn't want to go through all that work and then not get the waiver. And I assured them that we would get the waiver, and we did. I was also discouraged by the lobbyists who, the Retailers Association was afraid that we would be isolating Utah from the rest of the market. So initially I put the bill on hold, not knowing exactly how to proceed. The other bill that I opened, the bill file that I opened, was to remove synthetic food dyes and other petrochemicals from school food. Thank you. We've known for 30 years that these chemicals affect our health, and especially our children's health. They impact the cancer rate, ADD, ADHD, depression, anxiety, gastrointestinal disorders, and many other things. Yet, while the food companies made different recipes for other countries, they kept the cheap garbage recipes for the US because despite the fact that they had this information at their fingertips, our leaders and corporations didn't want to tell us about it. So the day before the session, I received 2 text messages simultaneously, one from Representative Lisenby and the other one from Speaker Schultz. And they both asked the same question: do you still have those files open? And I said, yes. And they said, good, because the administration wants us to pass them. So we ran the bills, not without opposition, and we managed to pass them. Another fun game that I got to play this session was there was a bill that would have put the flavored vapes back in circulation in Utah. And we had not had a chance to test out our bill that we passed the previous year that banned flavored vapes. So I got to run the substitute, standing between 2 people on the other side of the issue who were over 6 feet tall. And they were both standing next to me speaking against what I was saying. But I got to run the substitute and it passed. And so we killed that bill, and that was very fun and rewarding. So I had no idea what was happening next. It was a fun session. It was great. Within just a couple of weeks of the session, we got an invitation to a roundtable and press conference with RFK in Salt Lake City. He was starting his Maha Roadshow in Salt Lake City because we were the first to pass these Maha bills and the fluoride ban, which was Representative Grisha's bill. So that was what we got for that. We got to have RFK come here, and I was fortunate enough to be able to be in the roundtable discussion with him, and then speak at the press conference alongside him, which was very exciting. And I kind of felt like that was the highlight of my political career, and I thought, well, that was fun. About 10 days later, I got a call from Speaker Schultz asking if perhaps I could rearrange my schedule to fly to DC for another press conference with RFK Jr. And my text response was, yes. So I did that as well. And then while we were there, we attended a press conference where the speaker was able to speak. He met with Secretary Kennedy's staff in his, or we met with Secretary Kennedy's staff, and we met with a team at the White House to discuss Utah initiatives and what the administration could do to help us. We were told that Utah had changed the game and paved the way for the rest of the nation to create a climate where we are focusing on preserving and promoting health rather than treating illness. So then I was invited a week or two later to attend a Maha roundtable at the White House in DC with Speaker Schultz and his daughter Lainey, which was another great highlight. The discussion at the Maha Roundtable was about the chronic disease crisis that we are having. And the core finding is that today's children are the sickest generation suffering from escalating chronic disease. This is the first generation that is not expected to outlive their parents. And it is not acceptable. Some of the causes that were identified in the Maha report were food, ultra-processed foods, and corporate capture of policy. The environment, agricultural chemicals like glyphosate and PFAS, which are forever chemicals. Medicalization, overdiagnosis of conditions like ADHD, which results in unnecessary reliance on psychiatric medications. Initially, they sidestepped the vaccine issue, but they have begun to address it by bringing the U.S. in line with Denmark. Their vaccine schedule is 11 doses compared with our 72 before the age of 18. And their health outcomes are far better than ours. So that is a huge change and a welcome change. I don't have time to address the full backstory on this today, but I am happy to provide studies to anyone who has questions and who is interested in that change in the vaccine schedule, as well as the removal of the hepatitis B vaccine from the first day of birth, which is a huge step forward. I believe we're the only country that was doing hepatitis B on the first day of birth. And we were also the highest, I forgot what the term is, but industrialized modern nation. We had the highest death rate for infants of any of the forefront nations. So I'm interested to see what happens now. And also we have big concerns about screen addiction and lack of physical activity. Okay, so about a month after that Maha conference, Senator Cullimore and I flew back to meet with Secretary Kennedy's office. We were fortunate to have Congressman Kennedy join us for a meeting in RFK's office. One of the reasons we were there was to petition for help for Dr. Kirk Moore, who was facing a 35-year prison sentence for having exercised his conscience as a medical doctor to allow his patients informed consent when the government refused to allow it. And And we, in combination with a lot of other people making efforts, we were able to get the charges dropped against him, which was fantastic. We also discussed other issues supporting local agriculture, soil regeneration, and protecting holistic health options. So one of the things since then that I have watched is that many states have passed legislation similar to ours, some more stringent than ours, but it was our legislation that paved the path for the rest of the nation. And we watched the food industry adjust to the new demands without really missing a step, which was what they said they could not do when we were initially trying to pass the legislation. As a direct result of our being a leader in making America healthy again, Utah has been awarded a huge amount of money, over $500 million over the next 5 years, to promote health, specifically in rural areas. Some of us are working with DHHS to help direct that money. Prayers would be appreciated. It's a huge undertaking. There are a lot of competing interests, and it is not necessarily being managed by people who understand the concept of MAHA, which is making America healthy again. So if you would pray that the money will go to where it needs to go in order to actually help our communities, that would be welcome. We have an Overton window right now, and I think overall we're making good use of it. It's going to be difficult to put the genie back in the bottle because people are now paying attention to what's going into their bodies and the bodies of their families. Manufacturers are feeling the pressure. I'm told by people who stock the grocery stores that they are selling out of the healthier options faster than they can stock them. People are telling me everywhere that they're reading labels. In fact, some of the legislators who initially opposed the legislation are now reading labels and buying healthier options. We need to codify MAHA on a state level, because if it's just in federal rule, we know that it can change. So one of the things that we're working on is doing that. I have bills to require labeling of toxins in feminine hygiene products, require nutrition education for medical school, increase access to raw milk as opposed to curtailing it, which the Department of Agriculture is trying to do right now. Including the rural and charter schools in our food additives requirements, and requiring businesses to do in-person business to accept cash, which is a huge freedom issue. So please vote with your wallets. Industry is about money. If you buy it, they will make it. They are nimble. They will shift to accommodate the market. What they will not do is keep making better things if we're going to buy the junk anyway. So please vote with your wallets. Also be aware that Democrats are pouring huge amounts of money into Utah specifically right now to affect all of our races from the top to the bottom. And they are also indoctrinating our youth on social media heavily. They are working hard. We cannot underestimate the threat. We need to make sure that we're protecting our red state. So please be active in supporting good candidates. Also, please make sure you get out there to sign the Proposition 4 repeal petition. It's at table 1. We're in an extraordinary time, and it requires extraordinary vigilance, discernment, and action. So let's rise to the occasion. Thank you so much.